All right, I think we are ready to join. Welcome everyone, and thank you for joining us for our second webinar in the series of looking at the gendered impact of COVID-19 on livelihoods in sub-Saharan Africa. Today, we will take a deeper look at insights and data from South Africa, Uganda, and Nigeria, and we're very pleased to have a fantastic group of speakers with us today. And just to briefly introduce them, we will hear today from Petronella Tizora, who is one of the founding members of FinEquity's Data and Measurement Working Group. Petronella is a gender specialist at FinMark Trust, and she will share data and insights from South Africa. We're also joined today by Jimmy Evans. He's a research specialist with SSD Uganda, and he will discuss data from Uganda. And Tommy Eromosele and Jackie Juma are joining us from EFINA in Nigeria. Tommy is a research officer, and she will share data insights from Nigeria. And Jackie is a digital finance specialist with EFINA, and she will share a little bit about scenarios and persona work that they have been developing based on the data that they are sharing with us today. I am Diana Deje. I'm the Data and Measurement Working Group lead at FinEquity, and I will be moderating today's webinar. And please join me in offering a really warm welcome to our speakers. And I invite you to read more about their impressive background and experience on our website. And in terms of the agenda today, the way we thought about organizing the webinar, in a few minutes, I will invite our speakers to each give us a brief overview of COVID-19 related restrictions with a focus on the ones that particularly affect women in their respective countries. And then they will share with us key insights from the data that they have recently collected, with a focus on gendered impacts on livelihoods and sources of income, capacity to mobilize and use emergency funds, as well as coping mechanisms when facing financial hardships. After they each give us a brief overview of that information, we will have a discussion on how this data and insights are shared with key stakeholders, the implications of this information, data and analysis on financial inclusion and women's economic empowerment programming, and what are the next steps in data collection. And then we will have a question and answer session with you, the participants. And for that, I will invite you to to type your questions and comments in the chat box as we go along. So as we go through the presentations, just type your questions, and then I will read them out loud to our presenters during the Q&A portion. A reminder that this session is recorded, and we will share the recording and the slides with everyone in a day or two. So don't worry if you miss anything, you will be able to listen to it again and get these slides and the information that's shared on the slide. But before I will invite the speakers to share more, I wanted to give you just a brief description of the COVID-19 data tracker, which is the basis of our webinar today. I hope you can see the slide on the screen with the website where you can access it. The COVID-19 data tracker is an innovative data collection initiative of FinMark Trust and I2I to track the evolution of the pandemic's impact on livelihoods in 7 countries in sub-Saharan Africa. You see the countries here. The data collection began in early April, and currently there are 3 waves of data available. And more will become available in upcoming weeks. And the types of indicators, the categories that you can find data on include health, financial, food security, demographics. On the left side of the slide are a brief description, a brief listing of the categories included in the tracker. And then on the right hand of the slide, you can see 4 main ways that users can disaggregate the data by gender, by geographic area, by region, and by age. And I invite you to If you have not participated in our first webinar, to access the recording, you see a link to the recording on the slide as well, and we can send it in the chat as well, because it really gives a very good overview of how this data is collected, what is the methodology for analyzing, and how users can download the data set and how they can use that data for their own analysis. And now I would like to turn it over to our first speaker. I would like to invite Petronella. Let me give her presenter rights. I would like to invite Petronella from FinMark Trust to share with us data and insights from South Africa. Thank you, Petronella. The floor is yours.
Thank you, Diane, and hello, everyone. My name is Petronella, and I'm from FinMark Trust, which is a financial sector dependent agency for SADC. So our mandate is to make financial markets work for the poor, and we have several programs in the SADC region that are really aimed at deepening financial inclusion as well as promoting regional financial integration. And part of our work also focuses on the development of sustainable demand-side data collection. And this includes looking at how best we can get financial inclusion data more frequently and also at a cheaper cost. And Diana has already covered the COVID tracker, which we're using to collect data on the impacts of COVID-19 in several countries in Africa. So I'm going to speak to the South Africa case and start off by providing some background on South Africa lockdowns in relation to our data collection time period. So we had our lockdown on the 26th of March, and this was one of the strictest lockdowns in Africa, where initially people were confined to their houses. And this meant that one could only go out to sort of perform an essential service or to get essential goods or chronic medication. And sectors that did not qualify as essential were actually closed. So if one was employed in a non-essential sector or was working in a business that was not listed as essential, then it meant that they either had to work from home or they had to not operate. And because of the stay-at-home orders and travel bans, as well as closures to public spaces, this actually meant that people that were in the informal sector couldn't operate, and women are also overrepresented in the informal sector in South Africa. And this is a sector where people depend on daily earnings for survival, and there's actually no insurance against loss of income. And apart from that, we also saw the closure of schools, and this had implications on care work, and most of the people had to resort to homeschooling, and this also meant more family responsibility. And again, this sort of work falls more on women. But in terms of our data collection timing, we started collecting data in the week of the 8th of April. That was about 2 weeks after the lockdown. And during the same month, we saw further extension of the lockdowns until end of April. And there were also amendments to some of the regulations that looked at grocery stores operating if they had permission from municipalities, as well as commuter transport services remaining prohibited except when rendering an essential service. And in May, we had further lockdown extensions and introductions of levels of restrictions, with level 5 being the strictest. So over the past months, we have gradually moved to level 3, where we're currently at. And about 2 weeks ago, we sort of had a surge in the number of infections, and it was estimated that it was equivalent to 500 new infections in every hour. And this sort of resulted in the reintroductions of curfews as well as bans on families' gatherings as well as public gatherings. And besides that, besides the reintroductions of curfews, there was a further extension of the national state of disaster until mid-August. But in terms of the insights, I'm going to talk to data that we collected in wave 2, and that was during the strictest lockdown measures in what we called level 5, and also wave 3, which was collected in level 4. And in level 4, certain sectors were opening, that is your mining as well as essential repair and maintenance. And what we are seeing so far from the data is that despite the easing of some of these restrictions, more women are experiencing reductions in income. And the graph that you see now shows proportions of adults with reduced incomes, where in wave 2 on the left, you can see that 32% of the men reported that they had smaller incomes compared to 34% of the women. So this wasn't a very big gap in level 5 with the strictest restrictions. But as we moved to level 4 and with the easing of some of these restrictions and opening up of certain sectors, more adults were actually experiencing smaller incomes. And this was much worse for women, where 62% reported a decline in income compared to 48% of the men. And if we look at the sources of income, the majority of the population is salaried, followed by those that are in self-employment or business owners. And we've also looked at other data that is being collected on the impact of COVID-19, and Statistics South Africa is running web-based surveys, and we can see similar trends in income deterioration. And their survey also shows that there's been a decline in salaried people compared to the state before the lockdowns. And in another rapid mobile survey on employment and welfare of South Africans during COVID-19, the results actually show that 17 million people were employed in February 2020. And 47% of them were women and 53% of them were men. So we already knew about some of these pre-existing inequalities in the labor market. But by end April, or when we're now collecting wave 3 data, employment had dropped from 17 million to 14 million, which shows 3 million job losses. And the majority of these were actually vulnerable groups, that is, people in low earning brackets, those with no tertiary education, and women accounted for 2/3 of the people that actually lost jobs. And for those that are still in employment, our tracker shows that women are actually working for less average number of hours compared to men. So with so many job losses and reduced incomes as well as less working hours, women are actually struggling to make ends meet, which sort of implies that households will be pushed into food insecurity. And if we look at the different sectors where men and women are operating, we find that both men and women are in the retail sector. But besides that, we find that more men are in professional services, which means that they have a higher chance of receiving unemployment benefits. And men are also in services such as plumbing and repairs, and this could operate earlier as well as your transport, and this could also operate if specific permits were in place. And on the other hand, besides market and selling of goods, women are more in your domestic services and casual labor. And initially, people in precarious employment were excluded from unemployment benefits, and they couldn't take advantage of the COVID-19 temporary relief scheme, which was targeted at people that were on unpaid leave, as well as those that had been temporarily laid off, or in cases where the employer couldn't actually afford to pay salaries. And one of the main reasons for exclusion was that people in domestic and casual labor were actually not registered to claim unemployment funds. And this meant that they could not qualify until the end of May, when we started seeing some amendments to the temporary relief directives being made. But besides those, we found that women are also in your care services, and these require contact. And at that time when we had this survey, those sectors actually couldn't operate. They were on strict instructions not to operate. So what we're finding is that the sectors where women operate also contributed to lower incomes, and since the available relief had shortcomings, it meant that people actually had to turn to other sources to actually raise some money to cover some of the income losses. And if we look at the COVID tracker data, what we're finding is that during wave 2, or under the strictest lockdown measures in our level 5, it was much harder for people to raise emergency funds, and 16% of women compared to 21% could raise money in 7 days. And that sort of increased a bit to 24% for women versus 27% for men in wave 3. And during wave 2, people were looking more to tap into their savings to cover some of the income gaps. But what we see is that these savings reserves were actually depleting. And if you take a look at the graph that I've displayed now, which shows the sources of emergency funds, the light gray shows FinScope 2019 data, and the light blue shows Wave 2 data, and the dark blue shows Wave 3 data. And what we see here is initially people were looking to their savings, but this actually dropped to 26% in Wave 3. And there was also a drop in borrowing from financial institutions, as well as from family and friends and from groups or savings groups. And from there, we also see that there has been an increase in borrowing from money lenders. And this sort of indicates some sort of desperation by women, which is leading to risky sources of funds. And obviously, this has implications on how long it will actually take for women to return to their previous states before the pandemic. I think I will end there for now, Diane.
Thank you so much, Petronella. A lot of information, really, really interesting data. Not great for women, but definitely good to know about all these implications, and we will discuss a little bit more later. I would like now to invite Jimmy from FSD Uganda to share some insights from Uganda. Jimmy, I made you a presenter, and I will unmute you to be able to start. So please feel free to just move the slides on the screen to get to yours. Thank you, Jimmy.
Yeah, thank you. And so my name is Jimmy Bong. I work with financial sector in Uganda as a research specialist. I was leading within the institution initiatives that seek to ensure that a number of our interventions are taking concern of gender disparities, as well as building capacities of staff to raise their awareness and concerns on matters of gender. Financial sector deepening in Uganda is a leading institution on financial inclusion and inclusive financial market development. We do provide technical assistance and catalytic grants to enable innovation that drive financial inclusion, but also inclusive financial markets. We have engaged a lot in the areas of research, policy analysis, but as well as supporting the private sector in a number of ways. Most of our support to the private sector look at de-risking private institutions, what we commonly call them FSPs, financial services providers, but also in the areas of providing experimental grants that allow private sector to serve the real economy. Our target beneficiaries include women. We have done work for refugees, as well as youth and smallholder farmers. I am excited and glad to be sharing data coming from one of the initiatives that we as FSD Uganda are part of as a network of other FSDs around Africa. I would like to take you through what has been happening in Uganda since COVID was discovered or reported in Uganda. We're coming from a time when actually before the first case was reported, we were quite worried and really scared of what could be potential effects of COVID to Ugandans. And so the issue there was balancing between mortalities and getting the economy to remain functioning. But we got the first measures or lockdown. A number of things declared by the president came in an address on the 18th of March. and that's when schools were closed, religious gatherings were closed, and a number of other initiatives, through to the time when the first case was discovered on the 21st, or reported rather, on the 21st of March. And then thereafter, other measures, lockdown measures followed, which included border closures, and self-quarantine came in at that time. And the lockdown came in phases. So on the 25th of March, we had public transport closed down, and private cars were only to carry 3 people, through to another lockdown measure where curfews came into place. You're supposed to be out in the evening past 7. And we then started seeing the easing of the lockdown late around 4th of May, starting with allowing wholesalers, especially of agricultural produce, to start working in hardware shops, and then through to opening up of public transport later and private cars, to another time when the president announced some stimulus packages aiming at driving recovery of the economy and liquidity for farms. And up to yesterday, when now finally one of the main income generating activities for most people who live in the city, the borders, for those of you who are familiar with Kampala, were allowed to start working, and saloons were also opened yesterday. But shortly before that, before the announcements of yesterday, we had already started seeing a trend in that people were, I guess, tired. They started already defying presidential directives. That's a bit of a background about what has happened in Uganda arising from COVID-19. Indeed, we have seen that before these lockdown measures, already there are 3 sectors that contributed much income in terms of giving people income, and those included small businesses, people doing their own businesses, and in fact, wages still did contribute a lot for many, but also farming was one of those activities that was contributing so much income to Ugandans. And with COVID, we did realize, and the study, the COVID tracker, shows that yes, indeed, the number of people had their incomes reduced significantly, as this slide tells us. From the reduction in income, we do see that those who are living in rural areas were affected so much as well, in the sense that, as you remember, there was once a time that public transport was closed down. So there were difficulties in people being able to transport their commodities to the secondary markets or markets in towns and cities, but also the disruptions that came up as a result of non-functioning supply chains and value chains for agricultural produce. In that manner, did affect the income of those engaged in the agricultural sector tremendously. We did see that there is a pattern in which Ugandans respond or cope with eventualities such as COVID. We did see from FinScope already had given us some hints, and there were a number of ways that Ugandans respond. One of them being reducing expenses, the other being trying to work more, and the other being that they would get help from family and friends and use savings if the first 3 measures don't work. In the event of COVID, a number of these measures were not working. For instance, you can't go to work more because most firms were actually closing down and laying people off. Helping help from family members. Again, everyone was going through a difficult time. Although we do see some similarities still in the way from the survey, similarities in the way that Ugandans coped. And we also noticed that even in the way they coped, there were still some, you could trace some differences which are kind of gender specific. For instance, in a number of people rated on their savings, but also a number got help from family and friends. But we do see that from the wave one, women tend to get support from gifts from family, but also selling some assets. And through to a time when you see around wave two, we do see women working more, and men getting loans from money lenders as a way to cope. So there are some very gender specific differences in the way that men and women were coping with COVID-19. So borrowing, and we did see also from FinScope that a number of Ugandans don't seem to borrow much. This, from the data we get from this survey, confirmed what we knew from FinScope. I think that in this case, borrowing was even quite risky in the sense that as businesses were not working, it was risky to borrow, for instance, for consumption. And so maybe that could explain why we saw borrowing going down, or few people went to borrow. In the event that they would borrow, we see earlier family and friends being the most source of borrowing for many households, but also a number of people would borrow from shopkeepers. And the fact that they would go to family and friends has a lot to tell you about the role of social cohesion in supporting resilience of communities in times such as COVID-19. I would like to stop here for now and pass on the baton to someone else who will then be able to take us forward from there. Take it back to Diana. Thank you.
Thank you so much, Jimmy. Very, very interesting data. Thank you. Thank you for this presentation. And I will now like to invite Tommy from FINA to share some of the data from Nigeria. And I would like to also remind, let me just make a presenter. I would also like to remind participants to please post your questions in the chat. I see we have a few questions already coming in. If you would like to also indicate who you would like to answer your question, that would be super helpful as well. So let me, Tommy, let's see if this works. And welcome.
Hi, Diana. Can you hear me?
Yes, perfect.
Oh, great. Hi, everyone. Thank you for joining, and thank you to Jimmy and Petronella for sharing insightful data from South Africa and Uganda. So I would speak to the gendered impacts on livelihoods in Nigeria. I'm Tomi Aromsele, research officer at FINA, and FINA is the FSD country organization in Nigeria that has a vision to make the Nigerian financial system work better, especially for the poor. And we lead on financial inclusion initiatives across the network in Nigeria. So just some information on our own COVID-19 statistics, as well as the lockdown information as it applies to women. We had our first case sometime at the end of February 2020 in Lagos, about a month after we had lockdowns across 3 states. But there, essential services were still allowed to operate. Essential services including financial inclusion, financial sector players, food stuff suppliers or traders, things like oil and gas. So women were still able to trade, although for fewer hours in the day, from 9 a.m. to 3 p.m., but then the restrictions on movement still affected their ability to commute. Also the restrictions on movement also led to increase in prices, so that also affected them. Also things like restaurants, which are oftentimes owned by women or run by women, were not allowed to operate. People could only come into order and then leave. So that also affected some of the businesses that women are oftentimes more predominant in. Following that full lockdowns, about a month later, we had full lockdown in 4 states now. That's including Kano State, but then at that time we had partial lockdowns across all other states. So whether it had to do with curfews or some sectors being closed, all states had experienced one form of lockdown or the other. And that was actually when we started to collect data for wave 1. So as we go through the data, you will see the impact of this change in lockdowns. As at the time we commenced data for wave 2, we already had a nationwide curfew, which meant that across all states, there was a curfew from 8 p.m. to 6 p.m. We still had only essential services working, so most businesses were still shut down at that time. As we moved into wave 3, which was the end of May towards early June, the easing of the lockdowns began, and we started to see some form of opening of religious houses, full resumption of financial service providers. But up till now, we still have schools are still shut down, and so women are still likely to bear the responsibility of, taking care of children in schools. We have domestic flights has resumed, but then businesses have also been able to open. Curfews have been lifted, but as you can see from the statistics on the left of the screen, we have some kind of a very low death rate in Nigeria compared to the number of confirmed cases, and that this is about 2% death rate. I think the global rate is about 4%. So this has somehow led a lot of people to believe, that they want to go back to work. This is not really a problem, So currently, there's a lot of pressure, or there's a lot of anticipation from the masses to kind of move on and, just go back to their businesses. But just some information around, gendered disaggregated data for Nigeria before COVID. This data is from the Access to Financial Services in Nigeria 2018 survey. We see that women are more represented in low-income, monthly income earning brackets. So our monthly minimum wage in Nigeria is about 30,000 naira, and about 1/3 of women earn less than half of that in a month. So also when you look at the source of income, 1/3 of women rely on family and friends. That's a lot of vulnerability for women. When we also look at how women cope with financial shocks, we see that women are likely to say that they cut down on expenses, but then you also see a significant number of women who just say, they do nothing, or they just wait for donations from family and friends. So there's this high level of dependency, vulnerability, and as we also look at the financial access strand, more women are likely to rely on more women are likely to be financially excluded, and also less likely to use formal financial institutions. Just an additional information, in 2019, we also looked at just looking at the growing gender gap in access to finance for women. We also looked at some of the drivers, and we found that low income, low education, and low trust in formal financial institutions are kind of the 3 main drivers of financial inclusion. And because women exhibit lower levels of income, education, and trust, they are more likely to be excluded. I mean, even when we control for all other variables, women still are less likely than men to use formal financial services. And it will be interesting to see if this COVID has changed this in one way or the other. When we look at the COVID stats, we see that a lot of Nigerians have been able to return back to work. When we look at working in the past 7 days or earn money in the past 7 days, But then when we look at the income earned in the past 7 days, this actually speaks to individuals who earn income. We see that the income earned by women is on the average 20% still less compared to the income earned by men in the past 7 days. So this is not so much different from what we had from the A12 in 2018. We also see when we look at the source of income as well as, ability to cover living expenses, we see that at least 1 in 2 Nigerian women is, relied on her own business, to make money at this time. So in 2018, we had 42%, and currently it has gone up as high as 52%. So looking at how we can address the challenges that women businesses face would also be a critical factor to look at. We also see that although more women rely on regular savings as well as men, but when we look at the percentage of women that are able to rely on their regular earnings or savings, it's less compared to men. And also, again, similar to 2018, women rely more on gifts from family and friends to cover their living expenses. We also ask about how does the amount of money you made in the past 7 days compare to the amount you made this time last year. We see that about 2/3 of both men and women still record smaller incomes, which means that just about 1/3 of the Nigerian population have been able to return to their pre-COVID income levels. So women still remain are more likely to say that they are unable to earn money or they are unable to cover their living expenses at this time. So because there's 1 in 2 Nigerian women actually, relies on her own business, it's important to say, to look and say what are the challenges that their businesses are facing at this time. So a couple of things speak to women. So female businesses appear to be relatively more affected by fewer customers, and also when we look at financial challenges in terms of inability to pay wages, to cover, to raise funds or to cover expenses, women are more likely to face such financial challenges in their businesses. I would also say that one way that people have tried to cope with, the challenge of fewer customers, particularly, for men, is by taking up digital, ability to provide their services digitally. But the data is not here on this slide. But when we look through the data, we also see that women are more likely to say that they prefer to trade in cash, to remit in cash. So that's also one thing that would have affected the type of customers, the fact that they're affected by fewer customers, but also the nature of their business is also would also have led to this. But so we need to look at some of these issues as well. When we also look at, so at this time, obviously, in the pandemic, ability to cope, to raise emergency funds is critical. And when we look at how possible it is for men or women over this period to raise 1/20th of GNR income, which is about 45,000 naira in 7 days, to meet an emergency need, we see that a lot of Nigerians, about 70%, both for men and women, are not able to raise these funds. But when we look at the source of emergency, for those who are able to, we see that women are more likely to still rely on gifts from family and friends, even though for those who are able to, savings, regular earnings, top the list of sources of funds. I think it's critical here to also say that there's very, very little mention of formal financial institutions as the source of, emergency funds or, or ability to raise these funds. So whether for men or for women, the uptake is really low. Then finally, we'll speak to another way to build resilience or, cope with shocks will also be through borrowings. as Jimmy said, we also see that Nigerian population, or economically borrowing population, we have about 1/10 of the population has borrowed in the past 14 days. And even when we look at the 8/12/2018, just about 31% of the adult population had borrowed in the last 2 years. So there is that unease about taking up loans. But the interesting thing is also to see that taking up of loans from formal regulated financial institutions is also very low. Very few adults do that. In fact, about 1 to 2%. So both men and women still rely on family and friends as their main source of borrowing. And women are more likely to borrow from groups. There's about a quarter of women. So if you remember from the 2018 survey, we said women are more likely to be informally included. They're more likely to rely on informal financial service providers as well. So in general, I think we'll say women are more economically and financially vulnerable, and they are more likely to rely on informal groups. So Diana, I think I will stop here, and so we can have a conversation.
Thank you so much, Tommy. Thank you for being aware of time. This is really, really helpful. And before we dive a little bit deeper on the implications of the data that you all shared, I would like to see if Jackie maybe wants to say a little bit, speak a little bit to the scenario analysis that you've developed looking at these gendered outcomes from a persona lens. So Jackie, if you would like to add a few, just really briefly, and then we can go into more of a discussion mode. Thank you.
Thank you. Just to add on what Tommy has said, we consider the scenarios analysis approach to actually just understand how digital financial services would enable resilience and recovery amongst the low-income households and businesses. And we considered the personas that had already been built by Dalberg. And just to bring out a few additional insights on what we found amongst the women personas, we realized that with limited access to digital financial services and even just digital resources, it's a bit hard for the women to cope in terms of managing their finances, particularly women in the rural areas. We had an example of Zainab, who is a smallholder farmer in the northern Nigeria area. And from her lack of, even just having a basic phone, and, her lack of having access to formal financial services, we see her being quite vulnerable in terms of the pandemic effect. And, she's sort of, severely impacted because she's dependent, she's a smallholder farmer, dependent on sale of her, small produce in the local market. And when things like, the restrictions come in, she's blocked from, both having input go into her farm, as well as she doesn't have anywhere to sell her produce. So because of that, her income is largely disrupted. And we are, when you look at how digital financial services can help the likes of Zainab, we see that, for example, this is a very good candidate for CCTs, conditional cash transfers. We see that in as much as she doesn't have a phone, there are workarounds on how she may have access to financial services through the agents, for example, and providing her a phone through, of course, collaboration in the financial services industry would have her access to the digital platforms or digital community where she can still run her sales through reaching her customers digitally. Another example from now an urban setting, we had Victoria, who from what we see had a bit of medium vulnerability. Why? Because Victoria started off at the onset of the pandemic, we see Victoria had access to the phone. She also has access to digital channels. And although she had this access, we found that she was moderately affected such that, in as much as she has this access, the pandemic brings some uncertainties in her income flow. And just looking back on how might we help Victoria is just again to provide her with that digital step to enable her, have access to information, as well as enable her be connected to the digital marketplace. Because in the long run, considering she was just a salon girl, somebody who was just working in a salon, and because of the social distancing and the directives around staying at home, she's, her income is disrupted. So having this digital opportunity provides her with, additional, she's able to work remotely and reach customers, as well as just cushion her, her lack of income through working remotely. Thank you.
Thank you, Jackie, so much. And this is really a nice segue to a little bit of a conversation on, so what can we do with this data really? And just a brief comment that probably everybody is able to see that even though these three countries are so different, the similarities on how the pandemic is disproportionately affecting women are striking. And we see this from all corners of the world, especially in the area of livelihoods and sources of income, given how, the types of industries in which women work or the types of businesses that women run, the unpaid work that the additional unpaid work that they now do, and the availability of sources of funds, the way they can cope with emergency. So it's really very interesting to see the similarities. But we know that data collection, as this is a wonderful effort to collect all this data and to analyze and provide these insights. But this is only the first step in the, what are our next steps, or what are the implications of these insights for women's ability to rebuild their livelihoods. So I would like to ask our presenters, and maybe I would like to invite Petronella first to answer briefly, I'm aware of time, just a little bit about, any adaptations, changes that you've seen in South Africa for financial service providers or other stakeholders. What are some of the implications for financial inclusion programming, women's economic empowerment that this data and these insights have? Thank you, Petronella.
Okay, thanks, Diana. I think since the lockdowns, data each and every month is sort of painting a clearer picture on the impacts of the pandemic. And though the restrictions are being sort of eased in some of these countries, there is a possibility of going to stricter restrictions, especially if the rates of infections continue to rise. And this again will reflect on the results, and there will be different insights depending on the policy measures that will be put in place. But what we see in the case of South Africa is that the impacts of the pandemic and the lockdowns have sort of hit the most vulnerable groups of people the most. That is those that are low skilled, less educated, and we saw that 2/3 of the women actually lost their jobs. So I think the income losses mean that more houses will be pushed into food insecurity, and this is worrying. And there will be further job losses as businesses actually continue to close. And I think a lot of sectors that employ women have been affected, and businesses actually haven't recovered yet. Meaning to say that it will be in some sort of distant future when we can actually start to see people returning to employment or actually recovering from the pandemic. So in South Africa, we have a social protection program that is in place, and this has been sort of deploying income support during the lockdowns, and it makes it much easier to reach people compared to other countries that actually don't have such. So from this, we can see that digital financial services obviously play a role in supporting recipients of grants by providing quick financial support. And so I think there are opportunities to sort of strengthen cash transfer systems to increase financial inclusion. Though, of course, there must be considerations on the barriers of digital infrastructure, such as your mobile and internet coverage, as well as barriers like digital literacy and some regulations. And one of the things that is also worrying in the South Africa case is that relief that has been planned is not reaching the most vulnerable people that need it. So we've had social grants of about 350 rands, that is equivalent to $22 a month. But not all people that need it have received it. There's sort of a time lag between policy and impact, and it will be therefore important to sort of reflect on the social systems as well as programs and interventions, and to take stock on where we are and what actually needs to be done to address some of these issues that are faced by women. And obviously looking at our efforts so far and how women can be more resilient and how the financial sector can contribute to this. So I think there are opportunities to sort of expand on current transfer systems and on issues on things like care work and time spent on unpaid care work. It will be important to find ways of helping to reduce time on care as well as domestic responsibilities. And interventions could be the provision of water, electricity, as well as tools or equipment to actually lessen some of the time that is taken on household tasks. And long-term initiatives on this should be considered, perhaps looking at early childhood development centers, how to best support them in daycare centers. And also public messaging around the importance of care work is important, including how to best encourage men to share some of this work, and gender messaging on or during the early stages in schools. And hopefully this will tackle some of the norms on household responsibilities. And on
Great.
Sorry.
Well, yes, one more comment, Petronella. Thank you.
Oh, okay. And on the issues of savings depletion, I think it would be important to also see what is currently happening with the current interventions, and perhaps what would be needed would be the identification of productive investments that can actually lead to personal economic benefit, and also engaging informal savings groups to sort of encourage members to save towards or to have longer term savings. And I think on the issue of dependency on loan sharks in the case of South Africa, this is also worrying because it obviously impacts on recovery, and we would need to sort of investigate more on why women opt to borrow from informal lenders, as well as looking at whether this is actually a reflection of informality or lack of paper trail to actually meet credit regulations. So I think reflecting on what's currently there and what interventions would work best to address some of these issues.
Thank you so much, Petronella. This is a really great analysis, and I appreciate it. And I would like to turn it over to Jimmy with two questions from our participants, one specifically to Uganda and one for all presenters, but I would like Jimmy to answer first. Really briefly, we only have 6 minutes left. So Jimmy, the question specific to Uganda is whether there are any indications on how lockdown restrictions affected smallholder food production during the growing season. And then also, you all mentioned that a way of coping and responding to this crisis is that respondents cut down on expenses. So Jimmy, do you have any examples of what kind of expenses are being forgone, or how do they, do participants stop paying for school fees or anything that is significant in their lives? So Jimmy, please, thank you, briefly.
Yeah, thank you. If we have any indication of how the lockdown affected production in the rural areas or the agricultural productivity issues, yes, definitely, yes, it did affect production. Yes, we note that although agriculture sector per se was not locked down in terms of farmers were able to produce. If you're transporting your produce to the market using a truck, for instance, you are allowed to do that. Inputs were trading and buying was not locked down. They continued working throughout. Even in the markets in Kampala and other towns, the markets which were allowed to operate, some of them are the markets where they sell food items, or agricultural products. But let's note also on the other side that we had scenarios where there was, from the point of even just fear, things around gatherings in places were not allowed. Issues like this did not directly affect production, but did have effect in terms of how a farmer, for instance, would be able to move their produce from the farm to the main markets in the towns. There were other issues around, even if you could trade inputs, but issues around financing for production were affected in several ways. That, as we saw in some instances, that farmers, and I think for most, wouldn't want to invest at that particular point into, if you're seeing that demand has gone down, for instance, there was some kind of fear in the sense that many wouldn't want to put in a lot of increasing production at that point in time, when you're seeing that the market for the produce has come down significantly. So in these ways, agricultural production was affected.
Thank you, Jimmy. A quick comment on very important expenses that people maybe forgo or cut down before I save 1 minute for the closing.
So the expenses they cut down were more on things that are not productive, some kinds of luxury here and there. So people would love to keep the little money they have to finance things which they valued so much more. So you would want to have food in the house, you would want to have some medicine in the house, and stop other expenses that is considered, in this case, not very essential.
Thank you so much, Jimmy. And just a note on all the questions that we're receiving, the ones that we are not able to take live right now, we will answer in writing. So we will reach out to all the presenters and ask for their comments and inputs on all the questions that we're receiving. So if we don't have time live and we are running out of time for additional questions to address live, don't worry, we will still send you comments and information. In closing, I would like to briefly, if you can see the slide on the screen, just a few additional sources for other data collection efforts that you might be interested in. One from a virtual roundtable on women's economic empowerment. You can access that link and listen to a few more programs and inequity members who have similar efforts and how they acted on that data. And then in our newsletter next week or in about a week, we will share a curated list of other data collection efforts that might be of interest. So in closing, I would like to invite Petronella to super briefly tell us about the next steps in the data collection of the COVID-19 data tracker. So just really very briefly, Petronella, and just to let everyone who had questions about how the data was collected, the methodology, what's the difference between wave 1, wave 2, wave 3, all of those questions are being addressed in our first webinar, and I posted the link in the chat. So everyone who has questions on that, everything is truly addressed in that webinar. You can, and the slides, so please access those as well. So Petronella, elevator pitch, what are the next steps in the data collection?
Okay, so we're collecting a total of 5 waves of data in each country. And in almost all the countries, we've got 3 waves of data, but for South Africa, Nigeria, and Kenya, we will be launching wave 4 data this week, and we'll be collecting the remaining wave 5 in early August. In Uganda, we have 2 waves of data remaining, and wave 4 data collection starts next week. And in Zambia, we're launching wave 2 this week and collecting data for wave 3 next week. And in the case of Ghana, we're launching wave 1 data this week, and wave 2 data collection starts next week. So all the data will be available for download from our COVID tracker website at covid19tracker.africa. And we'll also have the top line indicators per country, and one can aggregate that by sex, age, and location.
Fantastic. Thank you so much. So once again, thank you to our fabulous presenters, Petronella, Jimmy, Tommy, Jackie. Thank you so much for all your insights. Thank you to the participants for joining. And please make sure you keep your eyes open for the recording, the slides, and the responses to all the questions that we got. Thank you, everyone, so much, and have a great rest of the day.
Thank you.
Thank you.
Thank you.